Hi, I'm Gordon Irving, Medical Director of the Swedish Pain and Headache Centre. Let's look at what fibromyalgia is, why people get it, and what can be done about it. So, what is fibromyalgia? What makes someone who has fibromyalgia wince even at the thought of a hug, even from a loved one? Fibromyalgia has been around a long time. This is a description by a famous medical doctor, William Osler, in his book, Principles and Practice of Medicine. Sleepiness is frequently present. The aching pain in the back of the neck is the most constant complaint, and there are spots of local tenderness in the spine. Now, the date of this publication, 1869. In 1990, a group of rheumatologists who were doing research and wanted to have a better definition of widespread pain syndrome they were seeing in their clinics got together. This way they could compare any treatments or findings. So they coined the term fibromyalgia, and the so-called tender point examination came into being. So this is where the doctor pushes on different areas of you, and if you have more than 11 out of 18 tender points, i.e. painful points, in 3 areas of the body, it indicates you have fibromyalgia. More recently, that same group of researchers have published a symptom severity score chart and a widespread pain index. That does away for the need of the trigger point exam, which obviously is very prone to examiner error. I could push hard, or I could push lightly. There have been many studies documenting differences between fibromyalgia and other pain states, and even those who don't have pain. These have shown differences in the brain scans, in stress, growth and thyroid hormones, as well as lowered androgens. There are also automatic nervous system changes and decreased concentration of certain important neurotransmitters and neuromodulators. So no longer can anyone claim there are no biochemical or MRI, functional MRI changes that can be seen in fibromyalgia, and it is a fictitious illness. This is incorrect. The tests are complex and primarily available only for research purposes, but the results are in. Fibromyalgia is a real disease or syndrome. We think these changes and others may lead to central sensitization of the nervous system. That's where the brain, even when they have non-painful sensations, the brain says it's pain. That is why pain is widespread. It doesn't come from the muscles themselves, but is from the central nervous system that misinterprets input. So, why do people get it? Bottom line is, we really don't know. There may be a genetic susceptibility. That's made apparent only after a viral illness or an accident such as whiplash. We know that relatives of someone with fibromyalgia are about 8 times more likely to suffer from it themselves, and females are 6 to 10 times more likely to suffer from it than males. Well, how do you treat it? Well, firstly, you need to improve your sleep. Sleep hygiene is really how to set up for a restful night's sleep, and there's plenty of advice on that can be found on the web. So if you have sleep apnea, where you snore and stop breathing, or if you have restless leg syndrome, these are medical problems that need treatment. Good sleep is very important. In fact, some people think fibromyalgia is primarily a sleep disorder. 2, lose weight. If you are obese, losing weight may significantly decrease your pain. 3, stop smoking. Every time you smoke for about an hour afterwards, the carbon monoxide you take in smothers the red blood cell, and it stops oxygen going to the tight muscles. People with fibromyalgia who smoke have more pain. 4, exercise regularly, but learn to pace yourself. Do too much, and what happens? You'll crash and burn. Pacing is important. 5, settle the mind. Cognitive behavioral therapy, mindfulness meditation are methods where you're beginning to use your brain to turn down the volume control. And you can get these on YouTube. Medications. 6. These have a moderate effect at best. The FDA have approved 3 drugs that have proved to be effective, more effective than placebo in studies. Pregabalin or Lyrica, which, like its older cousin gabapentin or Neurontin, work by decreasing the excitatory pain messages going up to the brain. Duloxetine or Cymbalta, and milnacipran or Savella, both of these medications dampen down the central nervous system, similar to their older cousin amitriptyline. There is no evidence that anti-inflammatories like Advil, Aleve, benzodiazepines like Valium, or most sleeping pills work. There is no evidence at all that narcotics or opioids work, and in the long term, opioids may make things worse, as they can actually increase the pain of fibromyalgia, something called opioid-induced hyperalgesia. So, is there hope for the future? You know, as our knowledge of this very common syndrome improves, our treatments are also improving. We're beginning to use an anti-opioid or an anti-narcotic called naltrexone in small doses, and it's working in some patients. Researchers are using repeated magnetic pulses, ba-dung, ba-dung, to change the brain processing. What the future holds, we're not sure. But one thing is for certain. Fibromyalgia is one pain syndrome that clearly demonstrates when the person starts looking after themselves mentally and physically, they improve immensely.